Hi, this is David Desert of Pancanology. I'm an engineer and 7.5-year pancreatic cancer survivor. I was treated at MD Anderson where I had curative surgery in September 2012. After that, I joined a clinical trial at Johns Hopkins, which I have been in since March 2013, almost 6 years now. I am co-moderator of a pancreatic cancer forum on the Cancer Forums, where I exchange ideas and concerns with patients from around the world. As a patient advocate, I've had the opportunity to interact with many patients, oncologists, nutritionists, surgeons, researchers, and even politicians. I make these videos to offer a science-based perspective on pancreatic cancer treatments. I understand that not everyone wants to read through all the technical literature, and I'm able to boil it down to what's important to patients. And so with that, I'd like to discuss some of the very first questions that come to mind from a newly diagnosed patient. Let's dispense with the where is the pancreas and what are the signs of pancreatic cancer questions. I'm assuming we already have it and you want to know something useful now. In this video, we'll talk about what are the best available treatments, what are the best hospitals, what do I ask my oncologist, and what are some resources that I can use independently. So let's get right into it. First, what are the best treatments? After years of poor results using single-drug chemotherapy treatments like gemcitabine or 5-FU, certain combinations of these same drugs have shown better results. There are currently two standout standard treatments. First is FOLFIRINOX. It started using in 2011. This is the most effective treatment in general, shrinking the tumor in about 1/3 of patients in its largest clinical trial on metastatic patients. It's composed of drugs all available as generics and has a low cost. Notice that I said it shrunk the tumor in only 1/3 of patients. And then there's gemcitabine Abraxane. Second most effective in general is this treatment that shrunk the tumor in about 1/4 of patients in its largest clinical trial on metastatic patients. Abraxane is a fairly new drug and can be quite expensive. You may have noticed that I'm using the phrase in general when talking about effectiveness. In my mind, this is an important distinction that has repercussions to your decisions as a patient. Right now, there's very little way to know which treatment will work for any individual patient. Oncologists are playing the odds, and by selecting these two treatments, they're trying to help the most patients. Ideally, we'd like to know ahead of time which treatment will work for us. In a few select cases, we do have that information. And that's why genetic testing is so important, which we'll touch on in a bit. Next, people often ask, what are the top pancreatic cancer hospitals? If possible, visit one of the NCI-designated cancer centers shown in the blue dots on this map or from the link below. What these hospitals provide is a depth of expertise, experience, and support that is hard to find elsewhere. I especially like the ones that employ a multidisciplinary approach where experts from various pancreatic cancer specialties such as oncology, pathology, surgery, radiation, nutrition, genetics, social work, pain management, and maybe others collaborate on your care. And I'd like to highlight the 2-day pancreatic cancer multidisciplinary cancer clinic at Johns Hopkins in Baltimore, Maryland. After a day of doctor's examinations, blood tests, and CT scans, their team of oncologists, surgeons, pathologists, and researchers will review your information and recommend a treatment plan. Johns Hopkins has some of the most experienced pancreatic cancer surgeons in the world. Of course, not everyone can visit these top institutions, and some of the best doctors are elsewhere. You should understand that you don't have to be treated at these comprehensive cancer centers. Many patients, myself included, go there periodically for updates to their treatment plans and then implement those plans closer to home. You can think of it as a prescription being written at a major hospital but filled at your local oncology center. So let's talk about talking to your oncologist. Have a prioritized list of what you want to discuss in your limited appointment time. You may not have time for everything. Decide your ultimate treatment goals and make sure your doctor knows what they are. This is a very tough cancer with a low survival rate, Not everyone will want to do chemotherapy. Others will want to do everything possible to be cured. Let the doctor know where you stand. If you get the sense that the doctor is giving up on you before you're ready, push back. This is the time where we tell you that you are your own best advocate. You know your body better than anyone. Don't sit back and take decisions about your care that you don't agree to. Question them. If you accept mediocre care, expect a mediocre outcome. Bring someone along to write down the important stuff, allowing you just to be present. If you don't feel like you have the capability to handle the research, assign someone in the family to do that heavy lifting. In the first few months after my diagnosis, that was my wife's job. You don't have to make decisions on the spot in the office. If you want time to think about it or ask other patients about their experiences, then tell the doctor you'll get back to them in a day or two. If you have lost weight or are just having trouble eating, ask about pancreatic enzyme supplements, often treated with pancrelipase. This is an easily treated and common condition that sometimes is overlooked by oncologists who are just focused on the tumor. Talk about the side effects of treatment, such as fatigue and nausea. Ask for multiple anti-nausea medications, ones that work in different ways. Know which side effects require a call to the emergency room, a call to the nurse, or just have to be endured until it passes. Ask for access to and then keep copies of your medical records. If you need to go elsewhere for treatment or another opinion, this can greatly speed up the process. If you decide to visit patient forums, keep track of your CA19-9 blood test measurements. After CT or MRI scan results, this is how we try to monitor our treatment progress. And here are a few reliable pancreatic cancer resources for you. Cancer.gov is the U.S. National Cancer Institute site. I go to the health professionals version of this site for general information on staging, treatments, and research. This site also lists the NCI-designated cancer centers that I mentioned earlier. Details about clinical trials can be looked up at the clinicaltrials.gov website. However, pancan.org makes a lot of effort in keeping even more up-to-date information about pancreatic cancer clinical trials. Pancan.org is the patient-oriented organization in the United States. With their Know Your Tumor program, they are spearheading the efforts at using tumor genetics to find more effective treatment options. NCCN treatment guidelines give the recommendations of leading pancreatic cancer doctors. Here again, I find the professionals version of the site to be much more informative. Let's Win Pancreatic Cancer has many survivor stories and reports on promising research and clinical trials. That's my quick overview of what new pancreatic cancer patients ask most often. If you take one thing away from this video, it's that you are your most important advocate. It's time for you to step up. If you have some more questions, join me at the Cancer Forums or check out some of my other videos on this channel.